And so after today's session, if you attended for the full 1 hour, and you do need to be in attendance for the full hour to receive credit for this, but within a few days to a week following this presentation, you will be sent a certificate of attendance, and this accounts for 1 hour of RCR training for those of you who are tracking such things due to NIH or NSF requirements. And with that, I will turn it over to Dr. Dean.
Thank you. Good morning, everyone. So I'm the chair of the USF IACUC. I've been chair for quite a few years. Prior to this, I was at Wright State University, where I was the chair of the IACUC there also. So I've had a little bit of background on this. I'm a researcher myself, a neuroscientist, and so I like to go through how the IACUC's organized and why there's an IACUC and what our responsibilities are and what our responsibilities are not only as the IACUC, but as animal researchers. Okay, so an outline of the talk is shown here. I'll not read it off, but we're going to go through and look at the regulations that we have to adhere to, then guide our administration of the IACUC and animal research here at USF. And then we'll look at some things about the protocol and how we do it, and how we review it. And then we're going to look at how we can address animal welfare concerns, which is very important. So first off, since the animal can't volunteer to do the research and they can't speak for themselves, it's important that we provide them the protections that they need so that their care and welfare is the best that it can be. The animal research is important because that's how we're going to advance biomedical sciences, and humans just aren't the only ones that benefit, but also animals themselves. There's a lot of animal research that can fall under the realm of veterinary medicine. Okay, so let's start with the Animal Welfare Act. That was enacted in 1966. And it's going to cover, and don't be alarmed by this, but it covers just the warm-blooded vertebrates, excluding lab mice, lab rats, and birds bred for research, farm animals, and horses not used in biomedical research. Now, as you'll see, we have other guides that also cover all animals, all species of vertebrates. But in terms of the USDA and the Animal Welfare Act, it's going to cover all these animals exclusive of the rodents, which, of course, is a lot of the animals that are used for research. It requires that we get animals from registered dealers and that there be annual reporting of our facilities where we house these animals. It mandates adequate veterinary care. We have to have attending veterinarians. We do here at USF. We have multiple veterinarians. And we get surprise unannounced visits from the USDA veterinarian inspectors to make sure that everything is being done according to the Animal Welfare Act. In 1985, it was mandated that an IACUC, or an Institutional Animal Care and Use Committee, be formed to oversee animal research at any government-funded institution. And so we'll get into that. Let's see. Now, in addition to the Animal Welfare Act and the USDA, we have the PHS policy, which is administered through the Office of Laboratory Animal Welfare, or OLAW. PHS is Public Health Services, and they will cover all vertebrate animals. So this includes all the mice and the rats and the birds not covered by the USDA. Oh, there's a guide that was developed, and this is pretty much, it is the guide for guiding us in our oversight of animal care and use. It's endorsed by the USDA and the PHS policies. It is assists in the care and the use of animals, and to determine if the work is being scientifically and technically and humanely done. It assists investigators with planning their experiments and how to do their surgeries, and what is the appropriate levels of what is the appropriate type of anesthesia for different types of manipulations. The guide was developed back in 1961, and it's now in its 8th edition, I believe. It was developed by the NIH, and it is endorsed by the USDA and OLAW, and also the triple ALAC, which is the Association for Assessment and Accreditation of Laboratory Animal Care International. We'll talk a little bit about that, but that's one of the accrediting bodies that come in every 3 years to make sure that the animal care and use programs are indeed as the best they can be. All right. Try to figure out. All right. So let me go back here for a second. There was a link here that would take you to the guide. I found out this morning that is no longer working, so I've added this slide, which is not in the deck that you have, but if you go to this link right here, olaw.nih.gov, and you go to policies and law, and then you come over here to the guide, there's a PDF that you can download, which is a copy of the guide for you to refer to. Triple ALAC, this is something that we're not required to do it, but it is the gold standard for putting the seal of approval on your animal care and use program. So we pay to have this done every 3 years. They come two outside inspectors, typically veterinarians, will come in from the Triple ALAC International, and they will spend several days going through our facility. Prior to this, they would have received all sorts of protocols and our standard operating procedures and our accreditation statements and so forth, so that they are well prepared when they come in, and then they tour everything and ask questions and meet with the IACUC, meet with investigators. And so we are currently certified by Triple ALAC, and this is again something we renew every 3 years. So USF's been accredited by Triple ALAC since 1977. The standards in the guide that we adhere to here at USF go above and beyond what's required by law. And so in addition to what's mandated by the Animal Welfare Act and OLAW and what's recommended in the guide, we quite often have some additional policies ourselves. So you can bet that we're making sure that animal research is done the appropriate way. And that's important also, not just for the animals, but also for the researchers. If we were to not be doing animal research the appropriate way with their best interests and minimizing pain and suffering, then research could be jeopardized at USF. So this is an important thing that we take seriously, that researchers need to take seriously. Animal research is a privilege. It's not a right for us, it's a privilege. And so we got to make sure that we do it appropriately. We also have Wright State, excuse me, that was my old university. USF also has a wildlife protocol. We have quite a few wildlife researchers in the biology departments. We generated a wildlife animal use protocol that has actually been used by other institutions since it was developed here. And there are a number of guidelines that you can follow for the wildlife research listed here. And these are all addressed in those protocols, which are designated as a W as when you apply for your animal use protocol. So why does USF have a NIACUC? Well, we have this to oversee all aspects of animal care and use program, procedures, and facilities. So we're not only evaluating researchers' animal use protocols, but we're also evaluating and overseeing the facilities that hold our animals. We're also overseeing the facilities outside the vivaria that when researchers work in their labs with animals and are approved for surgery there, we inspect those. So there's a big net that we have to cast to monitor this at USF. And it's not just USF. We also are the program for the VA Center, for the Moffitt Cancer Center, for the Keys Marine Lab, for New College of Florida, and for Florida Polytech University. So what the IACUC does, we ensure that there's the humane care and use of animals as outlined by the guide, which I gave you the link to a few slides back. Is mandated by the Animal Welfare Act and USDA regulations, by PHS policy at OLAW, and then by our own USF policies and standard operating procedures. The IACUC represents not only the institutions that they are reviewing for and monitoring, but also the community. And that is done through two ways. We have a community member on the committee, and all of our meetings are also open. Just a comment here, we have to follow the sunshine law in Florida, which means that we cannot meet to assemble and conduct IACUC business unless we give 72 hours notice so that the public can attend if they are so inclined. And so this is a very open process here. Okay, so what is the IACUC? It's mandated by the Animal Welfare Act and PHS policies. And of course, a little redundant here, but it's to ensure the humane care and use of vertebrate animals as used in research, teaching, and testing in compliance with guidelines and regulations that we've covered. USF is registered under the provisions of the Animal Welfare Act and PHS policy, and these are identified through these numbers, which you'll find on the website. PHS assurance number is shown here in yellow, the USDA registration number, and then our AAA LAC accreditation number. And some of you may refer to these and use these in grants and papers when you publish them. The IACUC serves as the local oversight for these federal agencies. So the USDA and OLAW are asking us to ensure on their behalf that everything is being done appropriately and that pain and distress are minimized. And that the research is appropriate too. OLAW requires institutions that receive federal dollars to conduct animal research to have an assurance. So this goes back to that PHS assurance number on the preceding slide. And in that assurance, it indicates that we comply with the federal regulations. It describes our animal care program. It outlines the maintenance of an appropriate IACUC, what constitutes it, and identifies the institutional official. So the IACUC has to answer to an IO or institutional official. And here at USF, that's Dr. Sylvia Thomas, Vice President for Research and Innovation. The role of the IACUC is to review the protocols, to review the program, the animal care program in the Vivaria, to look at the facilities and use area reviews. So there are 11 different animal holding facilities and as many as 40 or more outside laboratories where animals are taken from the vivarium and then used and surgeries are performed. Sometimes they are terminal surgeries, other times they are survival surgeries, and they return to the vivarium. So, but we have to inspect those, and that's done biannually every 6 months. We're in the process of doing that right now. The IACUC also has to review concerns about non-compliance. So if something happens, a deviation from an approved animal protocol, we have to form a subcommittee and address that non-compliance. It may have to be reported to OLAW if it's a PHS funded project. If it depends on the severity of the non-compliance. Once that non-compliance is investigated, corrective actions are taken. We have to then report back to OLAW the outcome of that investigation if it was initially reported. We also have to submit reports to the institutional official of not only non-compliances, but of all these semi-annual inspections that we do every 6 months. The IACUC is the final say for the membership are the institutional official, Dr. Thomas. We have the chair, myself. We have a vice chair, Dr. Pelon Thomas from the Moffitt Cancer Center. We have 11 members plus pool alternates. Our quorum is 6. We have 2 voting veterinarians. We have 1 or more faculty from each of the colleges or its affiliates. We have 1 non-scientist who also serves as the community representative who is not affiliated with USF. We have a retiree who was in the computer industry, who has been a very vocal and active member of our committee, very important member. And then we have a member with expertise in field studies or wildlife. And currently our makeup is shown over here, the number of members coming from each of these different units. Okay, so what is an animal? Well, it's going to be any vertebrate animal used or intended for use in research, research training, or biological testing. So invertebrates are not the concern. Vertebrates are, though. Animals under IACUC review include the non-human primates, dogs, cats, rabbits, guinea pigs, hamsters. These are the ones covered by the Animal Welfare Act, the USDA species. Everything else is covered by the PHSO law. Rats, mice, snakes, birds, fish, frogs, turtles, so forth. So everyone gets covered here, every vertebrate. Field studies must also be reviewed. These are conducted on free living wild animals and natural habitats, and observational field studies if encroaching in wild species habitat or if may impact health and safety of staff. So we look at a variety of animal types of studies. We have a variety of type of protocols to address that variety. The IACUC program provides oversight of research and activities involving animals. So we do that through our reviews of our protocols, through reviews of modifications to approved protocols, and every 3 years, there's a renewal of the protocol, a de novo review after the, so an approval lasts for 3 years. You then got to reapply and get that protocol approved again. We conduct semi-annual facility and program inspections. As I said, we're doing that now. And this is quite a process. It involves forming multiple subcommittees. At least 2 IACUC members are in each committee. There's always more, though, and we go around to those 40-some outside laboratories that use animals, as well as 11 different animal holding facilities. We facilitate compliance of animal research activities with the federal regulations and guidelines, and we perform investigations of allegations of non-compliance. And we also provide IACUC education and training courses, which those of you who have gone through the certification process know about those firsthand. When we do a protocol review, these are the points we have to address. We have to make sure that they follow the rules and regulations for the daily care, transportation, and use of animals. So, you know, you got to get from the vivarium to the lab. How is that done? Sometimes it involves a vehicle. Sometimes it involves a USF vehicle. Sometimes it involves a cart. We look at all that, and that's addressed in the protocol. We look at the design and the research that's being done and consider the relevance to human and animal health, as well as advancement of knowledge or the good of society. So we are not like the NIH study section. However, we are approving animal use, and we got to make sure that the experiments are indeed justified. And so it's a tight line we have to walk. But we do look at animal use and whether or not it's appropriate and the model is appropriate, and we can make recommendations to improve that if we think that there's problems. We want to make sure that the species is appropriate for the science question that's being asked. We want to make sure that the number is appropriate, and this isn't just minimum number, but also we want to make sure it's the appropriate number to achieve statistical significance. So there are times when we can take a protocol and look at it and say, this is not designed in the best way to really give us the end result, to give the investigator the end results after the animals have been used. And we would recommend additional animal numbers. We would recommend power analyses be done. We might recommend that initially a pilot study be done before the final numbers are approved. So there's a lot of serious discussions that go on with these protocols. Importantly, you want to avoid and minimize pain, discomfort, and distress, and have it consistent with sound scientific practices. And is the animal manipulation being proposed? Is it justified scientifically? You want to make sure that we have appropriate sedation, analgesia, and anesthesia. That's covered extensively in the protocol. And I should say that part of the process involves the veterinary pre-review of the protocol once you've filled it out. And certainly the veterinarians do serve an important role in helping to guide the decisions on this process. And I should mention, take advantage of the help menus that are included in the protocols. There's a lot of help guidance provided if you use that drop-down menu for all the questions that you are asked in the protocol. We want to make sure that the animals are painlessly euthanized at the end. or if they have an early endpoint that they've developed that they are no longer healthy, we want to make sure that they are not suffering and under distress, and make sure that if that can't be relieved, that they are euthanized based on the endpoint criteria. We want to make sure the animals are fed and housed appropriately. We want to ensure that those responsible for the care of animals are qualified and properly trained. That is something we monitor and quite carefully. And actually, a lot of the non-compliances we get are people who have not been properly trained, despite being listed that they were, and that was overlooked within the laboratory, and we need to often go back and make sure there's retraining involved. And if there are any exceptions to the principles that are outlined in the guide, we want to make sure that the IACUC will determine if they are scientifically justified or not. Importantly, when you're doing your research over time, as you develop your procedures and your experiments evolve, you want to keep the 3 R's in mind, which is reduction, refinement, and replacement. So can you reduce the numbers of animals that you need for a study, so that you are using only the minimum number that's required to give you valid, statistically significant results? Can you refine your methods, your surgical methods, to reduce and minimize unnecessary discomfort, distress, and pain? Or is there a replacement model where after you've spent many years doing neural recordings from cells, that you can begin to implement certain types of modeling to look at neuronal interactions and so forth? So remember the 3 R's concept when you're doing animal research. If you are on an animal protocol, you have to receive IACUC certification, and this involves faculty, researchers, and their research team who work with vertebrate animals or harvest tissues from those animals. They must be recertified every 6 years. The IACUC certification records are maintained in the ARC system under each individual's profile. You'll upload your CV there, as well as all your training documents. Certification requires an ARC account, as well as an online and possibly live trainings, and we'll go through those in a second. And if you are new to the lab and you need to initiate the certification process, this is the link you want to go to. Reach out to Research Integrity and Compliance with this link, and they can help you. So basic IACUC certification that we all need to have requires that you have an indication of animal experience. So you provide your CV and you specifically list the years of experience with your species. Remember that you should be updating that annually, changing your numbers as you get more and more experience. There's a health and risk assessment document that needs to be filled up by you and the PI. There's a facility orientation you must go through initially, and the ALAS online training must be taken to look at the laws, regulations, and policies. So we'll revisit a lot of the stuff that we've gone through here this morning. And then you need to take the rodent biomethodologies online and wet lab training for the lab that you're working in. Now, if you're involved with survival surgery, there's additional training you must do online as well as in-person training. And you would reach out to comparative medicine and go through the IACUC link to schedule that. Okay, IACUC submissions. We meet once a month, the last Friday in the month. The schedule is online under the IACUC website. All applications for use of animals, including animal tissue and research, education, and teaching, must be submitted to us for review and approval prior to conducting that research. There's no way you can work with the animals. There's no way you can order animals without having the IACUC approval. We have a pre-review process. Before you submit it to the IACUC, it goes through a veterinarian pre-review. And at this point, they're looking for welfare issues. They aren't looking at everything that the IACUC covers at its meetings, but they are looking at important welfare issues and making sure that all the appropriate boxes have been checked. They will send that back to you, and you will take their recommendations, and it is wise to incorporate those into the document. Otherwise, you'll just re-stumble again at the IACUC meeting. The the application is electronic. It's actually a pretty, it's been refined and improved over time. I think it's fairly easy to work with, but you can get training if you're a new user of it. And here's the link to give you additional information on the electronic form. Okay, the types, remember I said the types of protocols we review are varied. Well, we have various types of forms. We have the R, which is the research. It's the most prevalent one that we do. This goes to full committee review, and when it's a brand new protocol, never been reviewed before, never is not a continuing renewal of a protocol. So that's the research protocol. We have the wildlife protocols for the field studies and those that are working with animals in their natural habitats or collecting them in the wild. We have a breeding mouse colony protocol, that is the M. We have animal tissues, T, and anti-serum production, S. These are all reviewed by what we call designated member review, which means that they are not reviewed monthly at the regular meetings, but they can be reviewed at any time they're submitted. They go out for, there's an initial, I believe it's, oh boy, Farr or Andy, correct me, 3-day. They have to be made available to the committee members, and then it's assigned to a primary reviewer who goes through and reviews the wildlife, the mouse colony, the anti-serum production, or the tissue collection. Also, if it's a protocol that is a renewal that has already been approved before in the previous 3-year period and doesn't involve surgery, as I recall, that can undergo designated member review. Now, having said that, if it's DMR or designated member review, if the reviewer has concerns with it, they can call it to full committee, and it is then reviewed again and addressed at the full committee. But for the most part, under designated member review, those are much faster turnaround than having to wait for the deadline of once a month at the regular meeting. It's important when you submit the protocols that you look at the dates. They are due to the vet for the pre-review. I think it's 2 weeks before the meeting, and then turned in a week before the meeting. Andy, correct me if I've got that wrong. We cannot periodically, I get requests to do an emergency review because someone has forgotten to renew their protocol, or they've missed a deadline, or the granting agency wants it. The one issue is we rarely do emergency meetings because, again, because of the sunshine law, that requires a 72-hour notice ahead of time. Plus, it requires assembling a quorum of a committee that's volunteer membership. And their workloads are already quite large when you consider the number of things they review in terms of protocols, modifications, procedural changes, and non-compliances, plus semi-annual inspections. So I'm hesitant to call emergency meetings only under the most extreme circumstances. If you are concerned that a grant is going to be held up or missed because of a protocol that's yet to be approved, I've never had a problem with that. I always, if you contact me and I reach out to the program officer at the agency and let them know that when the protocol is being reviewed, we've never had a problem. So that's how we will handle the review process here. We have different pain categories you have to identify. We use the USDA pain category of C, D, and E, which are defined here as well as in the protocols. When we look at the pain categories and the surgical procedures that are proposed and the anesthesia and analgesics that are used, we consider all of this as listed here. We want to make sure that nothing's duplicative, that the research and the procedures are necessary because it is original research. They've considered alternatives to the use of animals. That's covered in the protocol. You have to justify the species, the number of animals proposed. That's in the protocol. And then in terms of the surgery, you need to justify the anesthesia that you use, the procedures you use. If it's multiple survival surgeries, that needs to be justified. and you need to have them performed aseptically in approved facilities. And this is where that online in person-to-person training comes into play. So yeah. And then, as I said, we have a semi-annual program facility review. It's required by law at least twice a year. The IACUC subcommittees do this. We look at all aspects of the program. So we not only meet to on multiple days to go through all these facilities, but then we also sit down and spend a very long period of several hours going through what the program is. There's a checklist to make sure that we have all these components recommended by the guide, mandated by Animal Welfare Act and OLAW in our program. And then we provide reports of these semi-annual inspections to the IO and then to OLAW. The animal facility and vivarium, I'm sure you're familiar with the ones that you use. Now, in terms of the animal care and use program components, it's not just us, but it's us working with you and you taking advantage of the IACUC and comparative medicine. So there's three legs to this stool here, and each component must make its contributions so that the whole is greater than the sum of the parts. So I would encourage investigators to reach out to the IACUC, to reach out to comparative medicine, and if you have questions or having issues, and we're more than happy to work with you on that. If you have concerns about animal welfare, we are mandated to investigate those concerns. My information and comparative medicine and veterinarians' phone numbers are all listed on all the animal facility doors, entry doors. You can also find us online. You can also use Ethics Point to make an anonymous concern about animal mistreatment that you've observed in a lab that you work in or in another lab or in the animal facility. We are then obligated to look at these and to determine if indeed there's something amiss and to address that and take corrective actions and make sure that that is fixed. Ultimately, to make sure there's no continuing animal welfare issues. Animal research, as I said at the beginning, is a privilege. If we receive research funds, if it's NIH, NSF, DOD, American Heart, whatever, we are mandated to make sure that the animal use is appropriate. We could lose that right to do research if it's not, and if it's done on a large scale. The IACUC's job is to determine that research and teaching involving animals is relevant to human and animal health, will advance scientific knowledge, and will be for the good of society. It's a privilege that you as a scientist, as a researcher, as on the staff, and it's your privilege, and you can lose this privilege if you abuse this and are a recurring non-compliant animal use person. So it's important to take this seriously. Without the use of animals, it would have been impossible to acquire the important knowledge needed to prevent much suffering and premature death, not only among humans, but also among animals. This is Dr. Sabin, the developer of the polio vaccine. Another example, not listed here, but I like to mention, is the fact that Sir Frederick Grant Banting and his colleagues used a total of less than, I believe, a dozen dogs to identify the role of insulin in a treatment for diabetes, which had been a death sentence prior to that. So it's incredible what animals have done for us in terms of our human health, but also in terms of animal health. So with that, I would open it to questions as best as we can. And thank you for your attention. And in the chat. Okay, I don't see any questions, so thank you. Jay?
Nothing further to add. Thank you, Dr. Dean, for that great talk on animal research. As I mentioned at the beginning, you can expect to receive your certificates of attendance in the coming days. Um, and as always, if you have any questions that you think of after the session has ended, please feel free to contact Dr. Dean or Research Integrity and Compliance with your questions, and we'll be happy to get you the information you need.
Okay, I see a few comments, but no questions. So thank you for your attention. Again, make use of us. We're available. We're not hard to find. Thank you.